and welcome to our special broadcast on fighting COVID-19 and the coronavirus pandemic. I'm Sonal Mirotra Kapoor. And as always, we are joined by Dr. Guleria on the program today to make sense of statistics, studies that we get on coronavirus, and also to answer all your questions that come in from NDTV viewers. Dr. Guleria, thank you so much for speaking with NDTV yet again. I want to begin by talking about the national capital. We are talking, Dr. Guleria, on a day when Delhi has reported a new peak. For the third consecutive day, Delhi has thrown over 5,000 positive cases. What does this tell us? Are we looking at a third wave?
In my mind, to say it's a third wave, you have to have the second wave coming down to an extent that you say the cases were down significantly for a sufficiently long period of time. When we had the second wave, the cases went up to around 4,000 or more, and they came down to around 2,000, but not for a substantially long time. So I think this is just a resurgence of the second wave only, and we're still seeing an ongoing trend as far as the number of cases are concerned. It's a cause of concern because unlike what we're seeing in the other parts of the country where cases are coming down, Delhi is actually showing increasing number of cases, and there can be multiple factors to account for this.
Right. And talking about those factors, Dr. Guleria, the Union Health Ministry said very categorically that air pollution is actually one of the factors leading to spike in these cases. They said a spike which is about 46% in cases in the capital in the past month as well. How much do you think air pollution contributes to these COVID cases?
So there is data which is emerging, which is looking at the link between COVID and air pollution. There's been one paper published even in the past which looked at SARS infection in China and air pollution, showing that there were increasing severity of cases wherever there was higher levels of air pollution. A more recent data published from Italy, northern Italy, tends to show that there is definitely a correlation that they found with air pollution and SARS case and COVID cases, both in terms of the number of cases and the severity of cases. And that had suggested that with each 1 unit increase in PM 2.5, the cases may go up by almost 9%. So therefore, air pollution leads to the higher chance of the virus staying in the environment, and it also causes inflammation of the lung, and therefore also predisposes to more severe infection as far as COVID-19 is concerned. So I think the rise in air pollution, the fall in temperature, which also promotes more of respiratory viral infection, all is contributing to a higher number of cases as far as Delhi is concerned.
So air pollution contributing, would it be fair to say then, or are you suggesting that it makes the virus more lethal in a way?
So it makes the chance of infection more severe, because we must understand that air pollution also causes inflammation of the lungs, causing a higher chance of respiratory problems happening. So both in terms of increasing the number of cases, but also increasing the severity in those cases, because we already know that people who have compromised lungs, who have comorbidities, tend to get worsening of their lung condition or their heart condition because of air pollution. And if COVID also causes inflammation, then this will lead to much more severe illness in these individuals. So there's a likelihood that you'll not only have more cases, but the severity may also go up. And therefore, in my mind, it's very important for us to work aggressively in trying to see whether we can, for this year at least, decrease air pollution to a significant extent.
All right. So people in the national capital who are listening to this are going to be very worried. What is your prescription to that? What should they be doing? Is it time that Delhi actually moves to N95 masks as well? Because just a cloth cover won't cut it.
So two things. One is we should ask all individuals to follow COVID appropriate behavior. That is very important, because we have to decrease the number of cases as far as COVID is concerned. As far as air pollution is concerned, we should be very vigilant, and especially those who are at higher risk, the elderly or those who have chronic respiratory or heart disease, should be careful about going out, especially when the air quality is bad. They should avoid going out if possible, or go out only at times when the AQI improves, or when it's bright and sunny, so that the warm air causes the ground level pollutants to rise. And as you said, those who are having respiratory problems or chronic heart problems need to be careful and may need to wear a mask which also protects them against PM 2.5.
So all those cyclists in the morning who've been stepping out, and that's been a trend we've seen, especially during the pandemic, what would you recommend them?
So I would say that especially because air quality is now, if you look at the data, quite bad in the early hours of the morning, especially those cyclists who have respiratory problems or allergies or other chronic illnesses should avoid actually cycling early in the morning. If they really want to cycle, they should do it later on in the day. This is not the best time to really be out early in the morning, especially if your lungs or heart is not that good.
All right. Then let's try and move beyond the national capital now, Doc. Now, spike has been seen in a couple of other states as well. Now, we talked about how the national average of cases actually going down and showing a downward trend. There are these localized sort of outbreaks that we've seen. It's not just Delhi, it's Kerala and West Bengal as well. In Kerala, let me just to talk about that first. Onam was said to be a super spreader event. But it's been almost a month to that now. Do you think the current rise in cases in Kerala is also related to Onam? If not, then what do you think is contributing to these figures?
So I think that was one event which could have caused increasing number of cases. But I think it's important for us to understand that when we talk of super spreading events, it means events where there are people who are crowded together and who are not having COVID appropriate behavior in terms of physical distancing, in terms of wearing masks. And we have one or few individuals there who are infective and can spread the disease quickly to others who are present in that crowded area. Now, this has been happening more and more often in the last few weeks. If you look at various parts of the country and you look at pictures coming up, whether it be because of the festive season, whether it be because of various functions, which could be marriage or other things, there has been crowds which are developing where people have not wearing masks or having their mask pulled down and they're not using a mask properly. All of these events have the potential of being super spreading events. It's likely that in some areas these events happened and there was some individuals or an individual there who was a super spreader, who was infected and who had the capacity to really spread the infection in a big way. And that event led to an increase in number of cases, and that led to a spike in that area. So I think we need to really look at the basic thing, and that the basic thing is that having crowds, especially in today's time because of the festive season that is happening, we need to avoid that. We need to see how we can really decrease this type of behavior, because these can be events which can lead to local spikes as we are seeing in certain areas.
Right. Dr. Guleria, we've seen the government take some steps as well. At least in the national capital and other places, we saw that there were no Durga Puja pandals this time around. No public gatherings as such is happening. But yet the spike we are seeing in cases come up. Would you say that at this time people are still meeting up privately within their bubbles, and that is also dangerous at this point?
So that's true. So what I've been trying to say is that there has to be involvement of every citizen. The government can do its part in terms of the Durga Puja pandals or the other events that they have banned or stopped. But you still have to be careful about parties that you throw inside your house, or the crowds that we see in the marketplace, which was not there in the past. So if you look at how things were, let's say 3-4 months ago, when we were removing the lockdown, people were still very, very observant of the basic rules of maintaining physical distancing. They would form a line outside the market. They would only go to the market if they had to really buy essential things, and they would continue to follow COVID appropriate behavior. Currently, that is not happening. If you look at the traffic on the road, if you look at things at marketplaces, you would feel that there is no COVID and people are going around without wearing masks, without any physical distancing. So we are actually promoting the spread of the virus in various areas, and we have to take a responsibility to do that. It has to be a citizen movement in terms of decreasing the spread of infection. And we've seen this, that in countries where this has been done, for example, in Southeast Asia, in Vietnam, in Taiwan, in South Korea, they've not seen another wave coming up. They've been able to have business as usual without increase in number of cases, because they had good behavioral practices. Whereas in other parts of the world, whether it be Europe or the US, where this was not followed, we are seeing a huge spike in the number of cases. So we should learn from what has been there in other countries and try and do that in our country if we want to have our economy also working and at the same time saving lives.
So what would your prescription be to those who are still carrying out with Diwali parties and kart parties in this season? If one is still catching up, what would your advice to them be?
My advice is that for your own safety, for your friends and family's safety, and for the general public, if for this year you were to forego all these events or postpone it till a better time, then that would be something that would be actually very, very useful, and it would help everyone in terms of decreasing the number of cases and us coming back to normal on an earlier date rather than prolonging it. The more we do all of this, the more we're delaying the decrease in the number of cases and the more prolonged the pandemic will be in our country. Therefore, if we were to just for the next few weeks follow good COVID appropriate behavior, we will be able to bring down the number of cases to an acceptable level. And then we could be comfortable as far as life in general is concerned.
I see. Dr. Guleria, I want to talk about UP and Bihar now, and even Madhya Pradesh. Now, these are states where we've seen massive crowding pictures come up. Some of them are going into elections as well. We know that the state of medical infrastructure in these states, it's not a hidden story. However, it's somehow not reflecting in the numbers that we are getting. So are these state figures dependable?
So I think so. There is a lot of monitoring which is being done at multiple levels. And you're looking at multiple factors. You're looking at the number of tests being done and the positivity of the tests. You're looking at hospital admissions and number of people who are getting admitted who are having influenza-like symptoms. You're looking at the deaths, and none of these can actually be hidden in totality. Therefore, I think the numbers may not be that worrisome or wrong, but the issue is that whatever you're seeing today, the effect of this, as far as respiratory infection is concerned, will happen approximately 2 weeks later, because that is the incubation period. So if we have an event which led to a spread of infection in a particular, say, area, it will take at least 10 days to 14 days for the numbers to spike there. And that is the worrisome part, that are we going to see a huge increase in the cases in these states in the coming few weeks because of what is happening today.
All right, we've spoken about separate areas in the national, in fact, not just the national capital, across the country. I want to get an overall sort of, the data that is coming up, and that from you, Doc. The national dip in cases, with the numbers from every state being not very reliable at this point. Maharashtra, for example, is also now testing less. How dependable is this national dip in cases? And is this a number we can bank on at the moment?
So I think we have to continue to do our testing. We should ramp up our testing as much as possible, and also focus both on RT-PCR and the rapid antigen test. They should complement each other. One cannot replace the other. The important issue is that if you are really wanting to have good, robust data, then you must have good amount of testing being done. Then only can you really be confident about your positivity rate. If you're not doing testing, or testing is coming down, then you may get a false value as far as your positivity rate is concerned. And I think that may not be right, because a lot of decisions for policymakers, for hospitals, for increasing your capacity are based on these data. So the data has to be very good and robust, and therefore testing is the basic foundation for all of this data, and we should not really decrease our testing. As a matter of fact, I think now is the time that we do more testing, because if we are able to do that and we are able to do our tracing, tracking, and treating these patients aggressively, we will continue to decrease the number of cases like we've been doing for the last few weeks. And we may actually, on a long-term basis, be able to say that we've turned the corner.
Do you think the figures that India is showing at the moment is dependable?
So to my mind, these are the best figures that we have. They do reflect how things are. These are the same figures that we were looking at a few weeks ago. So if we go by whatever margin of error there has been in the past, that same margin of error would be there today. And by that sort of numbers, there is definitely a downward trend.
All right. Talking about numbers and testing figures over there, Tamil Nadu has turned into 100% RT-PCR tests. Do you think other states should also follow suit? It should be made mandatory. So
again, like I said, we should focus more and more on RT-PCR. But in containment areas or symptomatic individuals, The rapid antigen test has the advantage that it gives you the result immediately within 15 minutes, and you can actually do an intervention. You can isolate the person, start the person on treatment within 15 minutes rather than waiting for 8 hours or maybe a day or two to get the report, and the person may be infectious for those 1 or 2 days and spread the disease. So both tests are useful, but the gold standard has to be the RT-PCR. So if your rapid antigen is negative, that doesn't mean the person is negative. He should have RT-PCR done, even if his rapid antigen is negative. So if we combine that strategy, it really helps us in both ways, that we are able to screen some patients and diagnose early and prevent the spread of a disease. At the same time, if the rapid antigen is negative, we are able to still diagnose those who have a low viral load within the next day or two, and thereby decrease the number of cases. So both tests have their role, but they can't replace it. So I think RT-PCR is the gold standard and should be done more and more.
Sure.
But rapid antigen has its place.
All right. Now, a recent study by Harvard researchers talks about how a person who eats at restaurants and steps out for shopping for grocery is actually at a greater risk of contracting the virus compared to someone who's traveling on an airplane. Now, what are your thoughts on that, doctor?
So a lot depends on 2 or 3 things, and there have been reports of even people getting infection in the first class on an airplane. There have been a case report of that also because of another person not wearing a mask. So if we are looking at traveling and exposure, traveling by air is relatively safe if everyone wears a mask, because of the fact that the air that is recycled in planes goes through a HEPA filter and it clears up the viruses if they are in the air. And if everyone is properly masked, then the chance of spreading the infection is less. It will also depend on the duration of the flight and how appropriate people are in terms of their behavior. As far as going to the market is concerned, again, if your exposure there is for less than 15 minutes, everyone is properly masked and you're maintaining physical distancing, the chance of infection is less. But if that is not done, the study suggests that then you are at a higher risk in a shop if appropriate behavior is not there, because you're coming in much more closer contact and the air is not recycled or properly filtered in terms of the virus in the air.
All right. Let me ask a couple of questions on vaccine now. Now, China, you know, has come out with a $60 experimental coronavirus vaccine that is rolled out in its East Chinese city. How effective do you think that is, and is an experimental vaccine an option for India at the moment?
So these are ethical issues. There are issues which have come up even from what has been tried, with what is being going to be tried in the United Kingdom, that you do your phase 3 as not as a trial, but as giving it to individuals and following them up more closely. Or you could do what is being done in the UK is like a human challenge trial, that you give the vaccine to individuals and then inoculate them with COVID-19 infection and to see how well is the vaccine effective. Now, these are strategies which are being done to decrease the time in terms of having a vaccine rolled out. They have their own risk. The risk is that you don't know how effective or safe the vaccine is in the long term, and therefore, as is being done in China, you will not sure, and you may have some degree of morbidity and mortality which you had not really looked at, and this may affect healthy people who are being vaccinated, and that is
all right. What about the BCG vaccine, doctor? Some studies also talking about how it's generally a common vaccine used to protect children against tuberculosis, but do you think it can provide immunity for elders as well, as some of the studies are suggesting?
So there is data which has been published, which has even before, which showed that BCG vaccine generates an immune response, which also gives some degree of immunity and protection against viral infections. It was not specifically against COVID-19, but against viral infections in general, because it stimulated various T cells and gave some degree of immunity. Based on that, there were studies which were done. I'm aware of 2 studies which were looked at retrospectively.
Right.
One study from Israel did not show much benefit, but a retrospective study done from Europe did suggest that those who had been vaccinated with BCG had less severe COVID infection as compared to those who had not been vaccinated. Okay. ICMR has now done a study which is still ongoing, but the interim analysis where they're vaccinating or revaccinating, giving a booster dose to the elderly, suggests that it may have some protective value. We need more data, but this is another way of trying to boost the immunity. It's not a COVID vaccine. It's a vaccine which boosts your immunity to fight against the virus.
All right. I have very little time, so the last question I really wanted to ask you is that there's another study that CSIR has done, and that concludes that countries with low GDP and poor sanitation had lower COVID-19 death rate. They have almost linked sanitation to the COVID-19 outbreak. What are your thoughts on that?
So this is again just an observation. Whether it really is related to some scientific cause or not is not clear. But there is one hypothesis which has been there for a long time, known as the hygiene hypothesis, which states that if you are exposed to low sanitation and you're getting recurrent infections, especially gut infections, then your immune system is always active and is sort of primed to fight against other infections, and you may therefore be having a better immunity as compared to if you're living in a totally sterile environment where your immune system is not stimulated that much and therefore is not able to fight any new infection which happens. That is the hypothesis, but I'm not sure we have enough evidence to say that this is a fact, and we need to have more real biological studies to show that it's useful. The current data is more based on epidemiological data of observation. Whether it's a cause and effect is not very clear.
All right, Dr. Guleria, we leave it there. Thank you so much for joining us and taking all those questions. We'll see you again next week. To all our viewers, stay safe. The numbers are down, but the virus is still around.
Thank you very much.